You're watching CTOM TV. Knowledge is power.
I guess the big question is everyone wants to know what prostate cancer is. I mean, apart from having a tumor in your prostate, which is what most of us know as prostate cancer, there's a lot more to it that's really important, that is important to understand in terms of how prostate cancer is treated and where the technology is going. And so, as Michelle's put on the slides here, everything in prostate cancer is based on the androgen receptor. And so, might ask, okay, what is the androgen receptor? The androgen receptor is basically a docking station. And I like to consider this as an analogy to a shipping bay of a business. Whenever something is to go into the business, you don't see the workers typically, or the FedEx guy, you don't see him delivering stuff through the front door, past all the offices and so on. They typically go to the shipping dock. And that's the same with cells. I think there's a lot of analogies in life that can repeat themselves at different levels of complexity. And I think this is a perfect example. Androgen receptors like a shipping bay. So a receptor basically binds something called a ligand. And the ligand can be many different things. In this particular case, the androgen receptor we're concerned with binds testosterone. And when it binds testosterone, it creates a signaling cascade that causes the cell to grow and proliferate. This is a normal standard process that goes on throughout our life. This is just a normal, healthy process. So what is a cell surface receptor? Well, I generalized over this a bit, and you'll have to excuse me because the way I explained it is I wanted people to understand that receptors basically are like a docking station. However, there's a variety of different types of receptors. Some receptors poke out to the surface, and they're called cell surface receptors. And then others remain inside of the cell. So if it's a small molecule like testosterone that can normally enter a cell naturally, then typically the receptor is going to be in the inside. More importantly, the androgen receptor, there's a variety of different androgen receptors. In fact, there's a whole class of androgen receptors. They each have their own names. There's about 4 of them, and each one, they're called androgen receptors, but they each have their own specific name and specific function. And they are cell surface receptors, and they're all over the body, in different cells all over the body. So they're not really involved with prostate cancer. The prostate cancer androgen receptor we're concerned with is actually referred to as a nuclear receptor. So it's just inside of the cell membrane. And what happens is the testosterone comes inside of the cell naturally, or through channels, and then it binds onto the receptor. And then the whole androgen receptor complex plus the testosterone gets transferred down to the nucleus of the cell, where it binds onto a bunch of different genes, and they're called DNA binding elements, and it activates a multitude of different genes. So it's not a simple signaling pathway. There's a cascade of events that turns on what they call androgen receptor associated genes. So once again, the ligand binds onto the receptor. Whether it's on the cell surface or whether it's just inside the cell, it's irrelevant. It's a receptor. And then it causes a change in the shape, or in this particular case, it translocates to the nucleus and binds DNA in this particular case. So what is prostate cancer? Well, prostate cancer is usually defined by overactivation of certain genetic elements. And those elements are involved, typically what we refer to as a wound healing process, or it's a growth process. So in our bodies, we have basically 2 types of genes. We have 25,000 or so different genes. And some of those genes are maintenance genes. They're turned on all the time. And then others are kind of growth genes. And they're only turned on briefly to repair damage or for us to grow. And as you know, our bodies are constantly growing throughout our lives. Our bones get changed completely about 8 to 12 times throughout our life. So, all of our cells get constantly changed, with the exception of some nerve cells. So what happens in cancer is you get certain mutations in the genes that are only supposed to be turned on briefly, the ones that we call wound healing, that repair damage to different tissues. They only get turned on briefly, then they get turned off. They get activated, so they get turned on permanently. And then we have a class of genes called tumor suppressors. And tumor suppressor genes, basically what they do is they will inhibit any cell that's rapidly reproducing. So in cancer, you get damage to both classes of those genes. And so I like to think of those as the brakes and the gas pedal. So tumor suppressors are like the brakes of a car, and oncogenes oncogenes are basically the gas pedal of the car. So just to cover, in prostate cancer, the specific mechanism is all related around this androgen receptor. So what happens with the androgen receptor is you'll have an abundance of these androgen receptors. You'll have too many of them, or there's a unique alteration. Everyone's androgen receptor is unique, and it's unique in the DNA. So the DNA has what we call CAG repeats, and CAG is just 3 different base pairs of DNA. So these repeats occur, they're called CAG repeats, and they occur in the gene of the androgen receptor. And so if you have a small amount of these CAG repeats, then your androgen receptors are really sensitive to any circulating androgens, and specifically testosterone. If you have more repeats, then you have decreased sensitivity to androgens. And one example of this can be seen in African American males. They have a decreased amount of these CAG repeats, and therefore have a heightened sensitivity to circulating testosterone and androgens, and that gives them a higher risk factor for prostate cancer. So with prostate cancer, you have an abundance and an overactivation of this androgen receptor. And it's caused by testosterone, which is its ligand, its binding activation ligand.
Thank you for watching Cetome TV. Subscribe below and stay informed.